Hi everyone, good morning. Dr. DeBoer here from Rise Chiropractic and
Dr. Christina Holland from Inclusive Care.
All right, so I think this is video number 3 already?
It is.
Ooh, video number 3. Lucky number 3. We're doing it. Hey, that's commitment. That's the first step, right? All right. So last week we talked about why we think it is so important to have a pelvic floor PT and a chiropractor during your postpartum journey after having baby. Today we're going to talk about when you're having baby, pregnancy, okay? So we're going to give you kind of our top 6 reasons. So 3 for a pelvic floor PT, 3 for a chiropractor. Obviously, there are many and many more, but we don't want to sit here. Maybe you want to hear us talk for like 2 hours, but you know, that could be fun, maybe not so much. I don't know. So we're going to kind of go through the top 6 reasons of why we think you should visit a chiropractor and a pelvic floor PT when you are pregnant. So Dr. Christina is going to start with her number 1 reason.
All right.
Right?
Number 1 reason that I see most women who are pregnant is pain. So people will come in, and it doesn't necessarily have to be pelvic pain, but sometimes, a lot of the time, it's we'll call it pelvic girdle pain,
right?
Low back pain, pubic symphysis pain,
right?
Even
100%.
Upper back pain as your breasts grow and like your center of gravity is changing,
right?
All of that. So yeah, pain would be the number 1. And I think a lot of people, do you see this too? A lot of people think like, oh, it's just normal to be in pain when I'm pregnant.
100%. So nothing against any other provider or anything. I'm prefacing it with that. But I will say 100%, if you are uncomfortable in pregnancy, there is something not balanced properly in your body. There is no reason to be in pain and discomfort unless there's some crazy underlying issue in your body. You know, you have like bad disc bulge or whatever, you know, that you should be in pain while you're pregnant. You definitely, or what I definitely see, and probably what you see too, it is 100% just body imbalance that can be improved. And it does not mean that it's improved by you giving birth to the baby, right?
Right.
So my number 1 too of why most people seek me out is 100% pain. So why don't you tell them a little bit about, because you said, what's probably the number 1 thing? Pain, like low back, pelvic,
low back and pubic symphysis pain.
Yeah, that is definitely me too. Sciatica, full-blown sciatica.
Yep.
What would a pelvic floor PT do to address those? Like if they came in and they were having those issues, what would you do? Like what would kind of be their experience?
Yeah. So it's a lot of movement assessment is the first thing, because it's why are you having that pain, right?
Right.
And so sometimes, I know in your world it's like an adjustment issue, and that can be really helpful.
Right.
And then, so my question is, what are you doing with your body that's kind of contributing to this potential adjustment issue?
Right.
Alignment issue, rather. And then, so trying to problem solve around that. And there are some things that, especially pelvic girdle pain is a really hard one, and pubic symphysis pain in the front is really hard. And so some of it is activity modification, that sort of stuff. So what are you trying to do? What do you need to do in your life? And how can we modify that so that we're supporting this pain-free?
So for you, it's a lot of discovery from the patient of like everyday movements or what they do at work or what they're doing for exercise or not for exercise.
Yeah.
And then also, I assume a tactile feeling of how the muscles are, if they're tense, if you're finding nasty trigger points or whatever, right?
And
okay.
Specific, sometimes like pelvic rotation and like
placement of pelvis. Oh yeah, we got this pelvis to play with.
Yeah. And so exactly what you said.
Yeah. So treatment wise would be some hands-on, but probably even more so like guiding, telling them how they should be moving, or that this is improper, this is what you should do.
Like this is when, if you're doing this movement, these are the muscles you should feel. If you feel these muscles instead, try and make this like small adjustment, see if that helps.
Right.
Pregnancy's hard, right? Because it's like shooting a moving target in the dark is what I tell people.
Yeah, 100%.
So I think that's sometimes why people will wait. They're like, oh, well, maybe this will change. But if you find that it's not changing, like definitely go see someone, because you shouldn't be miserable for 10 months out of your life. It doesn't need to be that way.
No. No. Well, and the biggest thing as far as pain with on the chiropractic side, I'm always looking at the pubic bone, or the pubic bones, the pelvis, and the tailbone, and then this even has a little bit of the spine on it too, and 100%. So as much as I am gauging muscles a little bit too, I'm looking more so at like what's the bone placement. So like Dr. Christina was saying, in pregnancy, right? So I'm going to demonstrate on myself. You can kind of see. So pregnancy, as your belly grows, you kind of get this normal posture where your pelvis has to naturally go forward. Your butt doesn't necessarily push out, but you just get that forward posture because of the weight of the belly. So like she was saying, you'll even have mid-back pain because where's the belly pulling from? Mm-hmm. Pulling from those mid-back muscles. But as you kind of start to get that increased lumbar curve, a lot of times, so in my world, you're getting irritation into that lumbar spine, exactly. The lumbar sacral area, tailbone area, it becomes more compressed, and that's when a lot of people have flare-up of sciatica or sciatic symptoms, maybe not a flare-up, just sciatic symptoms, sharp shooting pain down the leg, numbness, tingling, pulling into the butt, and then it all works into hips, so we get a lot of hip pain and a lot of pubic pain. So, I also do the Webster technique, which is a chiropractic specific technique for adjusting of the pelvis and protocol for the pelvis. I'll talk a little bit more about that with my number 4 reason. She's going to do number 3. 4 reason of why you would come in. But that is an analysis of not only the pelvis and everything like that, but certain ligaments of the pelvis. It's important for me, like you said, round ligament, sacrotuberous, which is in your butt, is a big one with a lot of pain and really tight. And the psoas muscle, which I'm sure you probably find too, is super tight because psoas muscle is deep. We'll call it deep back muscle. Again, as you get that pulling, that thing just gets super tight. Actually, it's really super tight in most everybody anymore because we sit so much.
Right.
But it is an important one in pregnancy. So for me, your experience would be you come in. Of course, we're going to do a history too. I'll feel around a little bit. No, I'll feel around a lot. I do spinal scan to really see how the body, it's reading muscle tension. So how the body is compensating towards the increased weight and pull. But then we do an adjustment, super easy, gentle adjustment with the activator to address exactly what I need to address and only that. So a lot of adjusting of pelvis, tailbone, your actual hip bones, and into the lumbar spine, and then all the way up to, and lower ribs, because lower ribs are out a lot. So a lot of people get this kind of weird pain around the area. All right. So number 1 and number 2 were pain for us both. Okay. So what's number 3?
So number 3 is confidence. People just want to know kind of what to expect insofar as delivery. Like, what are the muscles doing? A lot of people are just now hearing about pelvic floor.
Right.
It's kind of, I'm trendy for the first time in my whole life. So that's nice. But so we can really talk about what the pelvic floor is doing, what happens just through that process, what to look out for. And there's just so much crap on the internet, honestly. So sometimes people just want like a little bit of help to kind of wade through that.
Yeah. And it can be extremely helpful to talk to your girlfriends who have given birth. I will say this. If you have actually went through a birth, you only remember tidbits, okay? That is how the normal brain is. Your brain, I mean, if we remembered absolutely everything from birth, we'd probably never have another child. Yeah. So, our brain is very good at blocking certain things out. We'll just go with that. We won't go any further into that. But so it is great talking to your girlfriends and whatnot, but it is great to have a provider to sit down to maybe kind of, a big thing is, should we do coach pushing or should we not, or when to push or when not to. So I assume you kind of maybe guide them like what they might be feeling and how best to maybe go through that process with their pelvic floor in mind.
Yeah, for sure. And also because I have a lot more time with patients, like I see patients between 30 minutes to an hour, depending on what they need. That gives us a lot of time for me to get to know you. Right. And to be able to figure out like what is important to help you figure out really what's important to you and what you're going to need through this process. And it is such an individualized process, and we try and make it like a one size fits all, and that just doesn't make any sense.
No.
So
in anything that doesn't make sense.
Yeah. Right. Exactly. Right. So yeah, just and in regards to pelvic floor, core, diaphragm, abs, back, all of it. And just what to expect, and a reminder that your body is designed to do this, and you can do it, and it's going to be great.
All right, I'm going to put you on the spot, so if you can't think of something, no, it's not that bad. So when a pregnant lady comes to see you and is maybe kind of, super, super nervous or just unsure, I mean, we're all nervous. Even if you know what's going to happen, you still have that nervousness in your body. What's maybe the one thing you teach or tell them that might be kind of helpful during that birth process?
Sure, I think probably the thing
that maybe they haven't heard, or they might have heard it too.
I think breathing is a really big part of it, is like how to use your breath to your favor, how not to. So when you push, it's really interesting because in Western medicine we talk a lot about like purposeful pushing and
right.
timing that and being like you were talking about coached pushing.
Yeah.
But when you
and coach pushing is when doctor, midwife, or whatever is telling you to push, basically.
Yeah.
You know.
Yeah. But when you push, your pelvic floor contracts and is on, and that's actually closing the holes and like narrowing the space and increasing the resistance, which can be counterproductive to what you actually want when you are delivering.
Yeah. 100%.
So I think that's a big thing that a lot of people don't know. And so we talk about how to use your breath to be able to facilitate birth and delivery.
So connecting to the pelvic floor.
Exactly.
Right? Really? Okay. See, and so that's, I mean, we all, and depending on the birth class you've taken, some will talk about it, some won't, but we have a natural reflex that even if you don't do anything, that baby's coming out, you know, so maybe just kind of feeling into that a little bit, right? And kind of listening to your body and not necessarily the noise in the room, right? Okay, cool. All right, anything else about confidence in delivery, right? Okay, so what are we at? Number four. I can count, okay? Number 4. The next reason why most people see a chiro during pregnancy is some sort of malposition of baby. Baby is breech, baby is transverse, baby is head down, but they're facing the wrong direction, or they're sitting up on the pubic bone. So as a chiropractor, I never turn babies. I don't physically touch your baby and move them. I don't ever do that. I don't even really assess for positioning of baby. What I do is what I talked about in the last a few minutes ago. The Webster technique is a technique to balance the pelvis, release the ligaments, and allow the uterus to be in a nice big, we'll call it balloon shape. I guess that's most visual for people. Nice big balloon shape, giving baby ample room to flip on their own or get into proper positioning. Because most of the time what we find with malposition, unless there's actual like cord wrapped around somewhere, your pelvis is weird shape, that baby's sitting in the uterus is a weird shape and they're sitting in there funny, baby will move on their own if they are given enough room. So all my adjustments are putting the pelvis back into alignment, working on the tailbone, the round ligament. Like you said, the round ligament is a ligament that attaches on the front, comes up the front of the belly. It goes from little to massive. Everything in pregnancy, right? Yeah. Stretches. So that's where a lot of people can have pain and stuff like that too. Yeah. But assessing ligaments in your butt, your hips, and your lumbar spine too, and your tailbone. But just that adjusting allows the ligaments to be in their proper tension. So they're not too tense, they're not too lax, they're proper, and it just allows the uterus to be in its proper shape too, so baby can move. So that is probably the next reason why most people will seek out a chiro, and it's a good thing. Even if baby is in the most ideal position, the Webster technique is great. Just you want your pelvis in proper alignment and you want the ligaments and the muscles to be in proper tension so you can dilate. So you have the confidence to know that my body's going to birth this baby and baby's not going to get stuck or I'm not going to progress or whatnot. All right, so number 5.
Number 5 is exercise. So people want to have a lot of people want to have a safe and active pregnancy.
Right.
I love that.
Yes.
And I think that right now we kind of it's a spectrum. And on one hand, we have people like on Instagram who are doing toes to bars and rope climbs and like crazy gymnastic stuff.
I'm like
at like 8.5 months pregnant.
Yeah. I'm like, dang.
So that's one end. The other end is people are doing nothing. They're afraid to get their heart rate up like 10 heartbeats per minute, above their normal. They are worried about squatting. They're worried about picking things up. Here's the thing. When you have a baby, you have to be able to squat. You have to be able to pick things up. You have to be able to deadlift because that's how you're getting that big baby carrier in and out of the car. And so if you don't you
got to get them out of the crib if they're in a crib.
Exactly. Yeah. And so when people are in pain during pregnancy and providers or their friends or whatever just tell them like, oh, well, just don't do that thing. You're pregnant. You're not setting yourself up for success because then you have to do those things once you have the baby.
Right.
So for me, it's people come to see me because they want to know, okay, what things should I do? What things should I not do? In terms of like exertion, I always tell people talk test is the thing. So heart rate varies so much from person to person and honestly like through the stages of your life even.
Yeah.
So I'm not going to just tell you like, this is the heart rate you should aim for. It's really, are you able to talk and breathe during your activity? And that's a really like safe. The safe spot, which sounds like pretty obvious, but there are definitely people who.
Well, and like many times I've been working out and I'm like, Yeah, I couldn't. Yeah, hold on a second. Let me catch my breath.
Yeah,
you know,
right.
like yeah.
And
so
high level athletes, like they're in the red zone all the time, and so just kind of trying to balance athlete brain, mom brain, and find like a good middle for like a safe and active pregnancy.
Yeah. Have you found that because there's such this push to get your postpartum body back, you know, whatever that means, right?
Yeah.
That people it is harder for that highly athletic, maybe super in shape person to kind of like, maybe I need to chill a little bit. Yeah. So it's definitely a mindset issue, right? That you help on both spectrums, right?
Yeah. That's kind of what I refer to as athlete brain, especially because a lot of athletes are told to like push through discomfort, push through pain. That's part of the deal.
Yeah.
But there's a time to do that and a time to not do that. And at the end of the day, a lot of those higher, not even just higher level, but like very specific activities that are creating increased pressure on your pelvic floor. What I hear from high level athletes is that they wish that they had known what they were doing to their body during pregnancy, because they just don't have any idea, because they don't have good information around it. People will just tell them not to do anything, and they're like, bump that, I'm not gonna just quit, it's part of my identity. And
right. It's just like literally you could maybe do something extremely similar, kind of get the same kind of mental thing you need, and still be active.
You can work out hard during pregnancy. It's just going to look a little bit different. But but we want to set you up for long-term success so that you can get back to the activities you love after. I don't use a lot of the body back messaging, because to your point, like, what the hell does that mean?
Yeah. Well, and a lot of the stuff that we, you know, and everybody is super different. You know, you could be like that, super in shape, and it takes you a long time to get your body back. Like postpartum and having a baby just can do a number on your body that you just never thought would happen. You know, nutrient depletion, sleep deprivation, you just don't know. So I think that messaging is just crazy. And honestly, your body is not the same. Even if you look the same or whatnot, internally your body is not the same. Yeah. So it's just like I dislike that messaging too. And then it really on the other spectrum, right? The mommies that think, oh, I breastfed, so I gained 40 pounds. I should be like better. I should be 120, even though I was 140 before I had baby. You know, like this weight thing and stuff. And that everybody's body is different, and weight varies differently too, as far as postpartum and stuff like that. With exercise so basically Dr. Christina is saying, if you're at any part of that, like if you're at the one end of the spectrum, you like love to work out, you work out crazy, you don't do anything, and you want a happy medium, or you want to know what's safe, definitely to schedule an appointment with her. She'll sit down and not only talk to you, right? Assess what your goals are during the time, and maybe even assess some of like your posture and your band, you know, and stuff. And like maybe that exercise isn't great because you're overdoing one side or whatever.
One quick tip to know if something you're doing is beyond what maybe you should be, or maybe you need to do some modification or need to come in and see me, is if you have doming of your linea alba. So if this,
we will talk about that. We got to do a video on, because like diastasis is such like a hot.
I know, I'm so trendy.
Right? I know. Yeah, I know. I'm going to use that. I'm trendy too. No, I'm just kidding. But we'll definitely talk about that, because honestly, I've been in practice for almost 10 years already, and 5 years even ago, I assessed for it, but nobody knew what the heck it was. Now I have moms postpartumly, like specifically asking to be assessed, right? Yeah. And like, what the heck, even though I don't know if they really know what it is, or, you know, just want to be, so we'll definitely
stay tuned.
Yeah.
DR is coming. Yes. But in the short term right now to look for is if you get any sort of bulging or doming between the two layers of your six-pack abs, basically. Yeah. So it would be right down the middle here, and you can get it anywhere, like from sternum to pubic symphysis. And
you see it; it looks funky. Yeah. You know, so for sure, that if you're seeing that, she means that's not the right exercise.
Yeah, come in to see me, because we'll just modify, or it could be something that is just you're not turning on the muscles that you need to be turning on during that exercise, and you may still be able, if you love planks, like. We can work that out. We can figure it out, but we need to make sure that you're able to basically regulate your intra-abdominal pressure.
Just elevate the plank, okay? But so for sure, if you're looking, or if you're not working out and you're like, maybe I really want to, but you're nervous about it, you know? Yeah. Schedule an appointment. You can sit down and talk, and it's easy stuff. It's not like you're gonna come in and now you got to start doing like crazy exercises or something like that. Yeah, exactly. Pull-ups. Yes.
So,
right? I have an assisted pull-up thing next door. They could probably do pull-ups. Okay. No, I'm just kidding. All right. So last one from my standpoint as a chiropractor is probably really just getting your body ready for the postpartum, you know, and that's going to be a lot of with the pelvic floor PT too, right? Is just assessing and being able to guide you through your postpartum journey, because once baby is here, a lot of mommies start in pregnancy and they feel really great during pregnancy, and then baby comes and life gets hectic and they forget about themselves, right? Yeah. So getting adjusted during pregnancy will help your postpartum in the sense of everything's got to go back to normal, you know, not really normal, but, you know, the pelvis has to move back into proper positioning, especially if it was kind of out during pregnancy and that wasn't addressed. Pelvic floor muscles got to figure out where the heck they go, and ligaments got to figure out where the heck they go too. So getting adjusted in pregnancy just helps to facilitate that and get you back to what a normal pelvic alignment should be, that the scans that I do are looking more normal, and that you're compensating and balancing properly. So it just helps in that postpartum. And then obviously Dr. Christina and myself, we both do in pregnancy, just making sure you're breathing properly. So then that is just an easier thing postpartumly. It'll feel a little bit different, but that's what I do with a lot of my birth fit programming, is just getting back to breathing properly, getting that core to go back to how it should be, and as far as like a supportiveness, and then starting to strength train, right? And starting to get some semblance of what you were before baby came back into your life.
Yeah, I think about like your whole body's a system, right? It's a series of systems, right. and they all work together, and they all get information from the others. And so pregnancy, again, like with that moving target sort of analogy, it's just changing. The system is changing, and it's for you and for the baby, and that's so great, but then you kind of need to recalibrate it postpartum. 100%. And so if you keep it as calibrated as possible as things are changing, people just see much better results postpartum.
Oh yeah, 100%. So if you come into us in pregnancy and we're addressing pregnancy, but then you say, well, she care planned for me for postpartum, there is a reason why I still want to see you very consistently postpartum, and same thing, right? Like when you're ready to check them, why you're encouraging them to come in postpartum, because definitely I myself as a mother know that a lot of times I just kind of put myself on that back burner, and then you start to have, dysfunction and stuff that either you think is normal and it's not normal or whatnot. So if you come in pregnancy and we address pregnancy issues, but then we're also encouraging you to come in postpartumly, I promise it's 100% for a great reason. And sometimes you just need that. Postpartum is so crazy that if you don't schedule it and you're not planning for it, it don't happen. Okay? So, and we are both super, super flexible in both your pregnancy time while you're pregnant and postpartum, as far as, you know, visits get missed because we forget or life gets crazy or somebody gets sick. So do not think that because you cannot commit to Tuesday at 9 for the next however many weeks that it's going to be a problem. We will accommodate you 100%.
Yeah, for sure.
But yeah, just like any other video, if you have any questions, any comments, leave them in the comments. We'll answer anything you have. And please, if you're pregnant, get on our schedules, right? You can call, PM, whatever you need to do.
We're very accessible.
Yes, text.
And trendy.
Wait, can they text your number?
Oh.
Can they text your phone number?
Yeah, they can. Okay. I will put that in the comments.
There you go. Yeah. You can text too. I work off a cell phone, so. Yes. Yeah, and like you said, we're trendy. Look at that. So, all right, we'll be live again next week, and I'm not sure what we'll talk about. Maybe we'll talk about DR.
Yeah.
Maybe that might be a good place to start. Okay. All right, you guys, have a great day.
Bye.
Bye.